Hi, it's Heather and Erin again with Empath Partners, and today our topic is saying no in the veterinary profession. And so we're going to talk about really in what ways do we say no in this field, why it's necessary to say no, and how to say no, especially in those, kind of gray areas, more difficult circumstances. So Heather's going to start off with sharing an example of a time that she has said no in her veterinary practice.
Thanks, Erin. So yeah, I'm gonna start with a story of a time that I had to say no, and it was one of those difficult times where the client did not expect me to say no, and just kind of working through that and ending up, with us both understanding each other and what was best for the pet. So just recently, a client of mine at our clinic had seen a colleague and brought her little dog in. He came in for pain. He was very painful. He said, she said he's screaming and just uncontrollable pain is how she described it. And so this little dog is a fear aggressive dog, and so he is very difficult to handle. A lot of times to do anything with him, we do have to sedate him. And so he came in, and my colleagues saw him, and indeed he did look like he had probably back and or neck pain. They thought maybe neck pain. And so my colleague at the clinic sent him home appropriately, with some pain medicine, muscle relaxers, that sort of thing. He was treated for several days. And the following week, on Monday morning, when I walked into the clinic, I saw a message on my desk that his owner had called. He was not better. In fact, he was worse, and she wanted to talk to me right away. So I called her, and she relayed to me that she had finally been able to get him to take some of these medications. It sounds like for the first few days, she wasn't able to get very many into him, but they had figured out a system. So that was going well. But every day, a few hours before he was due for his next doses of pain medicine, he was having breakthrough pain and still very uncomfortable, screaming, the whole thing. And she did say that his neck had swollen up to what she described as 3 times, normal size. And so hearing that, I'm looking at my Monday schedule, which is completely packed, and knowing that he is a pet that's hard to work with, in addition to the fact that I'm feeling like, as a primary care provider, this is beyond what we can do to probably help this pet. He probably needs to see a neurologist if he's not getting better with the care that he was sent home with the week prior. And so I start to explain to her, given what you're telling me, given what we think he has, I want him to see, I want him to go to an emergency clinic where they have a neurologist in case that's what he needs. And it sounds like if he's having breakthrough pain with the oral pain medications that we sent him home with, he might need to be hospitalized and be given injectable. So I'm going through these things and telling her, I want for you to take him somewhere else. And she was silent. And she said, and I could tell her tone was irritated. She said, "Are you telling me that you won't see him?" And so, I mean, essentially she's right, right? I mean, that is what I was telling her, but I wanted her to know it's not just me saying, "Nope, don't want to do that." It was that I felt, given the situation with the time that I had in the day, and more importantly than the time that I had, because we will work pets in, even though it makes our schedule more difficult, we do that all the time. But the bigger factor was, I think he's beyond what I can help him with. And I think that's important as veterinarians, knowing what our capabilities are and when a pet goes beyond that, because then it's putting our ego aside and saying, I'm not the best one for him. And that's exactly what I ended up saying to her. I explained the reasons that I wanted her to go somewhere else, and basically just said, listen, it's not that I don't want to see him, but I think he needs more than I can give. right now,
Mhm.
given my ability, given the constraints we have, and I want to make the choice that's best for him, right? Not maybe the easiest choice for her, not maybe the easiest choice for me, but sometimes we have to make those hard decisions. So it was difficult, especially hearing that silence. I just kind of sat there waiting for the other shoe to drop, and I just, you could feel tension over the phone. I know she was upset, but after explaining my reasons why, and that it was because it's in his best interest all
Right.
the way around, she understood. and
The other
and
side of that is you're saying yes to the treatment that he needs, and you're
right.
hoping that she, as the client, says yes to the treatment that the patient needs. But I do like that you also talked about scheduling, because that would have been a harder no had it been something that you felt, hey, I this treatment that is needed is within my expertise, but I might have to still say no, because if I say yes to this and I don't have the time to really devote, you are saying no to all those other patients that
Right.
are going to be affected. And I think that's the thing that's just really hard, is that, sometimes we only look at that initial no, and we don't look at the domino effect of that yes or no. And it makes it a lot,
Hmm.
easier in a way to say that no, if you're really looking and saying, by saying no to this person, I'm saying yes to the other people that I've already promised a yes to. And so I
Which
think,
is usually way more than one person,
yep,
right?
yep.
So yep.
And
Yep.
which, we're kind of starting to go into the why, right? I mean, there's really a lot of reasons why. And your example talks about a lot of those reasons why, because probably the most important, which you highlighted, is what is best for the patient and the client. But you cannot, dismiss for you as a professional, right? And any spectrum, the veterinarian, the techs, the other
Hmm.
veterinary staff. And so
Right.
I think often when somebody omits that no, that they're really putting themselves into a position where they're not going to be able to say yes to other patients, and even if
Hmm.
it is you know by compassion fatigue, right, or by these secondary traumatic stresses. And so I'm glad that you had the first thing you said, even though you wouldn't have categorized it as the most important. But one of those things that you highlighted was like, look, I had to look at my schedule,
Hmm.
because that
Hmm.
individual client is not going to be caring about your schedule, and they shouldn't have to,
Hmm.
right? Like,
Hmm.
that's really where it's on, the clinic and the people that are doing the scheduling to be able to say the no, this is going to put us, in a bad predicament with our other clients or with our staff or whatever.
Hmm.
Can
Hmm.
you think of any other reasons, why some of these, it's very important to say no?
I guess if I'm thinking about other times that I've said no, sometimes it's in my personal life where my professional life and personal life cross paths. I get questions a lot from friends and family about veterinary things, and that does get difficult sometimes. I mean, I love what I do, but everybody needs a break from what they do. And so I do feel like, getting those questions, and most people are very respectful of it, but it does just get hard sometimes, where it's like, okay, I'm not at work today. It's a day that I'm spending with my family or doing something else. And so sometimes what I will do is not respond right away, and take that time, because I have to remind myself, I don't owe anybody these things outside. I mean, it is hard because I do want to be helpful, and I don't want to say, hey, I'm not at work right now, but it is, so I think what I'm doing is kind of setting a boundary, which is saying no, right? Setting a little bit of a boundary for myself, where it's like, okay, if I'm busy doing something, I'm not going to drop everything to answer a random question via text or whatever.
Right.
And so just setting those boundaries for myself does make it so that I feel differently about responding to things like that. If I'm like, okay, I'm not going to make this question take precedence over everything else, I'll answer it when I have the
Right.
time. It changes your perspective on it. I think if I jumped every time something like that happened, it would be harder. I'd be unhappy, you
And
know?
more, I found that especially with boundaries and things like this, the more that you end up saying yes when you should say no, the more likely somebody will ask you. And that's even, it's almost, I mean, it's probably not that easily explained, but if your clinic is just very good about setting those boundaries, clients can tell. And so, not only do you have that behavior from one client that may have heard you say no, but it kind of ends up being like just a general um, feeling, or, like you'll be less likely to have clients that haven't tried to ask you yet not, because they can almost
Mhm,
just tell this
mhm,
person is, this is for the best for me. And so it really, I mean, it's kind of hard for me to explain,
mhm,
but it is
mhm,
something where it's like, I mean, I've seen this in my profession. It's like therapists that have a hard time with boundaries, they tend to get the clients that are constantly pressing on their boundaries. And
mhm.
therapists that set those boundaries, they just exude that
Right,
energy of, look,
right.
this is in your best interest. And so the ones that are going to do it anyway, right? Because there's some people that are going to test regardless. Um,
Mhm,
it doesn't go as far, and it's easier for the veterinarian or the therapist in this example, or any veterinary staff, to say no, because it doesn't feel like this foreign, unkind thing.
mhm,
Like, I
mhm.
think a lot of times it's almost like, and you've had this experience where people have accused people of being unkind or violent to
Mhm,
other animals or whatever.
mhm,
But it's like it stays in that space less if you're
mhm.
showing, look, this is actually out of professionalism, boundaries, and
Right,
kindness that I'm
right,
saying no to you, because
right,
it's almost like, what you do with your kids, or your pets.
right,
If
right,
you keep saying yes, they're going to keep assuming that everything's a yes, and it makes it
right,
much harder to say no. Um,
right, right.
so we're kind of almost, then again, segueing into how, and I think one of the things, and you might even have an example of this too. First and foremost, I think it's hard when, you and the people that you're working with are at odds on what to say yes and no about. Right?
Mhm,
But that
mhm.
that can also come into play, where somebody is saying, look, why can't we see this new client even though we've said we're not going to see new clients?
Right, right,
So it's really kind of having that conversation again, looking at what's that domino effect. You
right,
think it's just one person, but that one
right.
person is taking away from your existing clientele. And
Mhm.
also, potential word of mouth. Somebody that the week prior to tried to be a new client is now hearing, oh my gosh, this happened to me, my next door
Right.
neighbor that was
Yeah.
a new client.
Right. And actually, it's funny that you give that example because right now, given that we're about to be two fewer vets than we normally have, and COVID, and a lot of clinics not being able to see who they normally see, we've had a lot of new clients. A lot of them are end up being no-show appointments. I would say probably 90% of them don't show up. And I think what people are doing is calling around, setting up a bunch of appointments and just taking whatever one comes first, right? And so
Mhm.
we've had a problem of a lot of new clients just not show up. So with all of these things, we've kind of decided we're going to have to put a pause, on accepting new clients. And so we have an online scheduling system that can't filter that out, right? And so a
Mhm.
new client can get on our website and schedule an appointment. And so what I've told my staff is we have to then call them and explain why, and so again, you can't have it be that someone who calls for an appointment is told, I'm sorry, we can't see you, but someone who goes around that
Mhm.
and not deviously, right, they
Right,
don't know. I
right.
mean, someone who is able to get through that gate and make an appointment online, you're not going to say, okay, well, we'll see you, because it's hard for us to call you back and say, I'm sorry, we can't do it.
Yep.
um, but yeah, I mean, I get it, and it's hard and it's uncomfortable, and I understand that, but like you said, I don't want anybody feeling like, wait a minute, I was told no, how come this person was told yes? What's going on,
Right. And again, not even considering there's a reason why you're not taking new clients now. And so, how would it feel to call every one of those existing clients and say, even though we've actually realized we can't take a lot of new clients, you might not get the appointment that you need in a timely manner because we said yes when we, right? I mean, it's
Hmm.
like, I think it sometimes it feels like the path of least resistance, but it's
Hmm.
not, right?
Right. Right.
So one of the, we're going to talk about how to say no, and you could just be like, no. But
Well, we
some
don't want to do it that way because we want to save
that are
relationships,
here.
right?
Exactly. And so I think one of maybe the one of what, in some regards, it's just practice. Like no isn't mean. No doesn't equal mean. And I think
Mhm.
a lot of times socially we're taught that. We're especially taught that as women, and veterinary profession has a high rate of
Yep.
women. And so I think, we have to kind of, again, look at what you're saying yes to, look at the positive aspects of setting that boundary and positive aspects of saying no. And that can switch that thinking to
Mhm.
it's not just me being mean or stubborn or unkind.
Mhm.
But what I found is one of the easiest ways to start that no is to acknowledge what that person wants. So in the example of the client that you said, I hear that you would feel comfortable with me seeing her and you want to bring her here. However, it's not appropriate, I can't because blah, 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 right?
Mhm.
It's not
Mhm.
in the patient's or her best interest to come here because of blah, blah, blah. And
Mhm.
any reasonable person is going to hear that and be like, okay, you're not just giving me what it's not about what I want, right? It's not about you withholding something that I want. It's about you helping me understand that
What's
I
that?
look to
Mhm.
something else and want that.
Mhm.
Um,
Mhm.
I think that's probably one of the most straightforward ways, and it also kind of slows that down, right? Because you were saying, with the silence on the phone, it's like all of a sudden you start to feel everyone's anxiety creeps up a little bit, and so it's like if I'm going to acknowledge what the client wants and then explain how I can't do that, and if and when possible give them an alternate solution.
Right.
So
Right.
for you it was, you're going to look at your colleagues that do neurology, or
Mhm.
for the new client, maybe you guys are working together in nearby clinics and you can say, you can try this one, you know what I mean? But so
Mhm.
that's not necessary. Like sometimes there won't be that other answer. And it
Right.
will just be, I hear that you're wanting this. I can't provide this because, um, but I
Mhm.
think that's probably one of like the good general rule of thumb. Is there any other ways that you would suggest on how to say no that you've experienced directly?
No, I mean, I feel like we usually try to do what you're saying, right? You want to acknowledge. I don't want anybody to ever feel like we're turning a blind eye to their concerns because a lot of times these are really stressful situations. So
Mhm.
I do feel like we try to acknowledge, we then try to explain why we can't, and then try to give options. And one thing that I will say, and this is new to this coronavirus time, is just like everybody else, we're doing curbside stuff, and one of my colleagues had someone give her some grief about curbside, and basically got on the phone and said things like, I just have to say, this is really upsetting that you're not letting me in that building. And he said, I don't, how do I know that what you're saying is happening is happening? I'm not there to witness. And so, my colleague handled it really well. She kind of did the same thing where it's like, I understand. Yep, that's understandable. But, this protocol is in place for our safety and your safety. And if you're unhappy with it, you are free to seek out a clinic that doesn't practice this way, which, side note, good luck, right? I mean, I think
Right.
everybody is, but there are some things where, like things like that, I feel like when it is something where someone just doesn't feel like playing by our rules,
Yeah.
I mean, I
Yeah.
still want us to be respectful, but at the same time, this is a hard no. This
Hmm.
is not negotiable. So there are some people that are just pushing boundaries because this COVID thing is fatiguing. They're tired of being told what to do.
Yeah,
And then some people do just have trust issues. And that's something where, we can only do so much about that. We
exactly.
are explaining as best we can. And if someone's going to have trust issues,
They're gonna have trust issues.
despite that,
And
they're going to have trust issues despite it,
and I would say I would walk each person through that same thing anyway, because either it's practice communicating that way, and that helps with what we talked about earlier, where you're just kind of your persona is I'm not going to let you press upon me. And so even if you can, see somebody and you're like, I know this is just about you trying to get your way and that there isn't actually
Mhm,
concerns, I would still, as a professional, go through kind of that same, and not at nauseam. Like if they're like, I don't care what's happening to my dog, you don't have to go through each stage, especially if you don't feel like you have time. But the more that you do that, it just becomes second nature. And then people also stop pressing, right? Because they feel
mhm,
like this person gave me an answer, even though that's not why I'm doing this. Um,
mhm,
so I don't have any more arguments, right? Where it's like, it's done. Uh,
mhm, mhm.
yeah.
Or the other thing that makes it done is we say, this is our protocol.
Hmm.
And if you,
Have questions, whatever, or
yeah, we'll answer your questions, but regardless, you're going to abide by this or you're not going to be seen.
right, right,
You're going to abide by these protocols and rules that we have in effect, or you won't.
right.
And that's your choice. And I do, I mean, people can make their choices. That's totally fine. And we're not going to be in a position where we're bending over backwards just to make everybody's whims happy. We can't, again. So
Yeah,
that's
you can't, because
boundary.
it's not
Us
it's not
saying,
healthy. It's not health. I
yeah,
mean, it's again, it's not like a choice of like I'm choosing to do more for you or and less for you. It's not one, it's not equitable for a client, which you don't want to do as a business. And it's not healthy for, the staff. It's not healthy for the patient. It's not healthy for that client or the other clients. And so I think switching and thinking of things in that way makes it much easier to say no, because you have a reason as to why you're saying no, and you're
mm-hmm,
not just facing the client feeling like you took away their candy,
mm-hmm,
right? So I
mm-hmm.
think it's like having that different perspective of this is actually better for you and it's better.
Right. Well, it's for the greater good, right? And I think most people can understand that. You might have to say no to one thing for the greater good of many.
Yep,
That happens quite frequently. And so, yeah, that is what we have to do.
good. Well, that's briefly on how to say no. Please, in comments if you want to continue the conversation about saying no. We would definitely do an additional with any of your questions or comments, as well as any other topics that you are hoping that we
So,
would like to discuss.
yep, sounds good. Thanks for listening.